Nothing would make my professional life easier than if everyone came in with the same histories, same philosophies, same conditions, same reactions, same everything. And nothing would make my professional life more boring at the same time. The beauty of being in this dental space, of focusing on biological and holistic principles, while also focusing on airway, sleep, and TMJ issues, is that every new patient exam is incredibly different. Every patient is truly living a health journey that is an N of 1. Even so, I found that most of our patients live in one of the following 5 groups. Which one are you? The missing piece. This patient knows that something's not right, but nobody's been able to connect the dots. This patient has been searching for answers for a long time. Maybe it's chronic fatigue. Maybe it's headaches, neck aches, or ringing in the ears. Maybe it's poor sleep. Maybe it's teeth that continue to wear down, crack, or break, even though you're doing all the things that you're supposed to be doing. You've seen providers, you've had tests, you've been given pieces of the puzzle, but nobody has stepped back and looked at the whole picture. Now, to be clear, I don't pretend to have all the answers. And sometimes the answer isn't found in dentistry at all. If the puzzle were that simple, it would have been solved already. But sometimes what patients need is not a miracle. Sometimes they simply need someone who's willing to slow down long enough to ask different questions. This patient often arrives frustrated, but they're also hopeful because they're still searching. And sometimes that's where the breakthroughs start. The optimizer. These are the patients that make up most of our patient population. If this patient is you, you probably already know what seed oils are. You've experimented with intermittent fasting, and you've spent more time reading ingredient labels than you've spent reading novels. You come in with a good understanding of nutrition, exercise, hormones, inflammation, and overall wellness. You've been to conventional dentists, but you've heard that there may be a different way of approaching dental care that may be more aligned with the way that you view your overall health. You're pretty sure biological or holistic dentistry is the right move for you, but you still have some doubts because it can be difficult to understand exactly how dentistry fits into your overall health and whether making the switch from your current dentist is worth the investment. Patient number 3, the professor. If this patient is you, you come in prepared. When I ask you why you've come in, you tell me, I've read the books, I've listened to the podcasts, I've watched the YouTube videos, I work with a naturopath, I've got my biocompatibility testing, I've got my blood work, I've got a tongue tie, I've got 3 metal fillings, and my sleep efficiency is 58%. And then you hand me a folder. Or you've already electronically sent me your folder. And honestly, I really appreciate this because what I see is someone who is deeply invested in their health and is willing to do the work. The challenge for this patient usually isn't motivation, it's filtration. You've gathered a tremendous amount of information. Some of it is excellent. Some of it is questionable. Some of it may apply to you. Some of it may not. My role isn't to tell you whether what you've learned is right or wrong. My role is to help sort through it through a dental lens, to help you determine what actually matters for you. The explorer. These patients are just starting their health journey and want to surround themselves with people who can guide them in a good direction. If this patient is you, welcome. You're probably not arriving with a stack of books or a spreadsheet that's tracking your sleep scores. In fact, you may have only recently heard terms like biological dentistry, airway dentistry, TMJ, tongue ties, sleep disordered breathing. Maybe a friend mentioned it. Maybe you saw something online. Maybe you're here because you've started asking yourself a simple question. What if there's more to this than what I've been told? You're not looking for all the answers today. You're simply looking for a place where you can ask questions without feeling silly for asking them. I love this patient because curiosity is often where meaningful changes begin. Not certainty, curiosity. She made me. These patients make up the second largest group of our Rest Dentistry family. This is definitely not you, because these patients skipped on to the next video as soon as they found out I was a dentist. But while this patient is not you, there's a good chance that you know this patient very well. It's the husbands and kiddos. I usually never get to see the husbands. They usually call in and cancel on the day of the appointment. Historically, our odds aren't great with husbands. But those who do come in have been wonderful people to meet, and many of them end up becoming some of our most lovely patients. But the kiddos, I see a lot more little people than I ever imagined I would. If you're watching this, you're probably not a child. If you are a child, watch your screen time, buddy. Instead, You're the beautiful parent who understands the benefits of developing strong health in your child. And as parents often do, you bring your child in first to see us and resign yourself to come in after your child's needs have been met. So truly, you fall into one of the other groups. So mostly kiddos and a few husbands make up this group. Maybe you saw yourself in one of these groups, maybe a little bit in several of them. The truth is that every health journey is an N of 1. This is very important to remember. The only subject in this experiment is you. What worked for your neighbor may not work for you, and what worked for the patient in the waiting room next to you may not work for you. My job isn't to tell you what to think. My job is to gather information, evaluate what I see, help you understand your options, and answer your questions honestly. Then, you decide what makes sense for your goals, your values, and your health. And if I can help you get there, I will. And if I can't, I'll do my best to connect you with someone who can. At the end of the day, that's really why we're here, to help.